Hello, hi, my friends. This is Jonathan Munoz here again for another episode on residency interview tips. And everything is getting closer and closer for things to open for you to start the application process. So it is a good time to start learning more about these questions. So as a reminder, the interview process most of the times when the preceptor or the interviewer it's a person that really tries to get to know you as a person. The questions will be very simple apparently, but you still have to put some thought on that. Still have to give in every question that you will answer an aspect of your personality, like you're a team player, that you are a hard worker, you're persistent, that you are resilient, that you're reliable. And so think about that when giving an answer, because each question is an opportunity to show a part of yourself, showing your maturity, showing your ability to deal with conflict, with problem solving, um, using technology at its maximal potential. So think of all those little things and you'll be doing great. And so let's go on the topic for today, and it is about ethical dilemmas. And it is one of those questions that come as, tell me about any ethical case that you faced before, or tell me about any ethical situation that you were part of, or what do you think about ethical dilemmas, um, or what's your understanding of ethics in medicine. So what the any way it is worded, you should have one or two cases in your mind for the ethics part. Why? Because why? This is the important part. Why? Why are they asking about ethics? You know, why do they care about this? Well, ethics, it's a very important part of medicine, and in the inpatient care setting and outpatient care setting, you will deal with that all the time. Also, in your interactions with the other residents, you will deal with that. So what it comes down to is you being able to identify this ethics situation and how to deal with it, and when is the right moment to involve the ethics committee, and why is it important for a primary care specialty. Why? Because ethics as a branch of medicine is present in any healthcare institution. There is a committee that's called the ethics committee for a reason, and it's usually led by one of the hospital staff. Like, could be your program director, it could be one of the preceptors at the clinic, it could be any hospitalist, it could be any doctor. There's always a doctor involved with the ethics committee, and it may happen that your program director is part of the committee. So that's why he is asking you about this, because he wants to know how much you know about the topic. And it's not only a question for you to answer. It's not only an opportunity for you to answer a question, but an opportunity to ask more questions and show interest. Okay, so this topic is gonna take a little longer because it's such a big topic and it's important. So let's start with, so the ethics in medicine has three aspects for us, for doctors: the doctor-patient relationship, the resident as a learner, and the doctor and the system domain. So let's start with giving examples of the doctor-patient relationship. The difficult patient. Um, so usually you will find a difficult patient. Um, for sure, you will find a difficult patient in training, or maybe you already found one difficult patient before. One of those patients that, even if he has, I don't know, severe pneumonia, and you explain that uh, a course of azithromycin is the best, the patient will say, "No, I don't want to take azithromycin. I want to take, I don't know, I want you to prescribe me a week of IV ertapenem," for example. Or the patient that you have seen before that is very deconditioned with difficulty in ambulation, falling and tripping all over, and you're trying to discharge this patient home, but the patient said, no, you're trying to discharge this patient to a rehabilitation center where the patient should stay for 1 or 2 weeks to recover, but the patient say, no, I'm an independent person and I'm going back to my home, nowhere else. And so you think about that, the physical therapist told you this patient is not safe to go home. You should try to send this patient to a rehabilitation center for 1 or 2 weeks at least before going to home. That's called transition, right? So you think about the word transition, and sometimes patients don't. Some patients that are very independent and they have a very unique way to see things wouldn't take this kind of advice, and so that's a difficult patient. A patient that, despite your good intentions and evidence of that what you are recommending it's appropriate, they have a whole different approach or thinking about it. So that's a good example to bring up in your own words or in your own situations. Challenges involving sensitive information. Like, let's say you have to give a patient results on their HIV or the sexually transmitted diseases, or anything that's very sensitive in terms of an advanced disease process, and you have to go into the room and say, hey, I would like to talk to you in private, but the wife is there. And the wife said, well, anything that you want to say, you can say in front of me. And it's not up to her or up to the bond that they signed when they got married. It's about the patient's preference. So sensitive information and the way you approach this is all about this part of ethics is all about the way you approach this situation. What is your thinking and how did you solve this situation, more than knowing about all what is behind ethics. It's more about, we're talking about behavior, trying to, for a program director, for your interviewer to identify if you can reason, if you have an appropriate behavior. Okay, so next one will be we talk about that when patient preferences, when they deviate from a standard of care, the lady that doesn't want to go to a rehabilitation center, right? And second domain will be the resident as a learner. So let's think about this one, because it's not only doctor's patient now anymore, it's about you as a resident and your interaction with other residents. So resident as a learner, the topics that are commonly seen or that you could relate to, it's when someone is moving away, when a doctor or a learner or a resident is moving away from one area to live to another state, to another country, to a different job, you are leaving patients behind. You are leaving your old patients. If you have a primary care practice where your patients are established with you and they have been following you for years, now you are leaving these patients, and you're not leaving them because you want to leave them, but you're leaving because you're moving on to the next stage of your life. So if you face this situation, if you have faced this situation, you could bring this up as in the ethics question as, well, I have one of these situations, these ethical situations, when I was about to leave Pakistan to come here to for residency, as I had a big panel of patients and it was hard for me to leave the practice. And every time I had a patient's visit, I was explaining this probably will be the last time we will see each other, but it was a great experience for me. I hope I contributed to your health. And so you took, even if this opportunity or this situation was sad for you and posed the thinking that you were abandoning your patients, you knew that you were moving to a better stage of your life, to the next stage of your life, and you decided to open to your patients, telling them that you're leaving, why were you leaving, and being grateful for their being part of your life. So I think those will be the key aspects when you are answering this question. Um, Identifying the problem, not escaping from it, um, giving a face-to-face, I don't know, face-to-face opportunity to discuss this with the patients or with the person or with anyone that you're dealing with, and the last part is being grateful. Okay, next one is respecting others, resident and interactions with others. So respecting others and making others feel respected, that's a big issue in residency. So you might have to say, um, if you want to bring up that case, it's great. Just be careful when you do it, because it's such a sensitive topic. But it's very common for residents to have some disagreements, because there's so many different personalities and they spend so much time together. So it sometimes can come to one resident talking to the preceptor about the situation and creating a whole conflict. So you could say that you have seen in your previous practice, or in your previous role as a primary care physician in your hospital, in your local hospital, that you have seen how colleagues get into these disagreements, and when it came to you being on part of this disagreement, you didn't want to escalate these things rapidly, but you wanted to talk to this person in private and openly about what's going on. Why are we having these many disagreements or these situations when we should be striving to work together? And so we came to talk about, how she was feeling that I wasn't listening to her concerns or her complaints. And now that I know that she was feeling that way, I made my best to make her feel appreciated, make her feel heard, and so our relationship improved from them, and we didn't have that issue again. Or how you intervene to help other residents that were having a similar situation. Okay, and dealing with your mistakes or the mistake of others, and this is very important as an ethic problem. If there is a medical problem that you committed or you were aware of on your team, or your interns, or someone that you're taking care of as a preceptor or as a supervisor, if there's a mistake identified, you should talk about that with your patients. Even if the mistake didn't cause harm, you should just be open. And that should be, if you bring that example to the table, you should be open and say that you discuss this mistake with the persons that were involved. So let's say in your last year of medical school in I don't know, India, you accidentally prescribe Tylenol to a 5 years old that didn't need Tylenol. He needed a Zyrtec for his allergies, and you gave him Tylenol. So even if Tylenol is a very simple, not very harmful medication in patients that doesn't have liver disease, this kid got a tablet of Tylenol without needing it. So the best way is that you have to talk to the family about it. So let's say you had the situation in your last rotation in India and said, well, I did have to face an ethical situation when I was back in India, my last day of or my last year of medical school. I accidentally prescribed or gave one of my patients Tylenol when he didn't need it, and all he needed was Zyrtec. So we identified the problem early, and we had a hard time thinking that is this something that we need to disclose or not. but we ended up disclosing it, meeting with the family and saying, this is what happened, and we're keeping an eye on him. He's not in any danger, but we wanted to explain you this because it was a mistake. And the thing is that medical errors and medical mistakes, identifying them and being open about this is becoming a big thing in training. So if you bring up that topic, elaborate on the topic, and you were able to talk to the family, you can bring up how the conversation went. As long as you were open and honest about it, then I think you're in a good situation there with your example. Helping others, always a good example to bring up. Let's say one of your partners or one of your colleagues or interns wasn't able to come to work or was coming late to work, and you say, oh, okay, I'm gonna cover for your patients for 1-2 hours, and I think it shows that you're always able to help and that you understand other situations, that we all have a life, and you have a family and people are aging and someone can fall in sick, and you're able to help as many times as you can, as long as there is a good reason to help. Okay, next one, doctor system. This one is probably one that we see a lot in our countries, and we're gonna finish with this one. Is the factors affecting doctors' behaviors, such as the relationship with industry representatives. So basically, the farm representatives that come to your office to give you, I don't know, samples, products, meals, gift cards, gifts, money, anything. It happens a lot in my country, in Peru, and it does affect the doctor's behavior in the time of prescribing medications, sending referrals for nurses, for infusions. It does affect them because they get part of this, the money that's involved, they get part of that, or they get all these gifts. So I've seen that, and if I were to ask a resident, or that, this will be a good example, because it's something that you will see, and it's very important for us in the United States, for residents and even practicing doctors to be aware that we should not be getting these gifts, these motivation packages like trips or I don't know, spa treatments. And so if you're able to, I'm pretty sure you have seen this situation, it's a good answer to give during the interviews. So I would say something like, well, have you seen have you been part, or have you faced any ethical dilemmas or any ethical problems? Tell me about it. Yes. Well, I come from Peru, as you know, and in my years of training, learning, I have worked with many doctors, and I have seen that in Peru there's a big problem with industry representatives trying to bribe doctors on their prescribing practices by giving gifts, giving trips, or giving money, and it affected the patient that they were seeing, as sometimes these medications, brand name medications, are too expensive for them to cover. So over time, my government have worked on improving this situation, and for the last 2 years, 3 years, or 10 years, we have seen a reduction on this practice, and we have seen how pharmacy representatives are bound to some regulations now, and it has helped the access to medicine, to medications for all the patients in my country. And I'm very grateful for that. I'm very relieved to know that patients are getting all the options that are available at a very accessible cost. And it's okay to talk about cost of medications and all that, because remember, a big topic or trending topic in medicine in these years in the United States is health equality, health access to care, access to medicine. So those are my recommendations on ethics. I think you have faced all of these during your school days in your countries, or or if you're working right now, you have faced this. So it's about how you word it and how you frame it. Um, so good luck, guys. Don't forget about this question, very important. It will come for sure for many programs. I hope most programs try to get to know you as a person and not to test you with all these questions. But this is a competition, so be prepared for the possible hard questions, which is this is one of them. So I will post a link of some references for ethical situations. Common ethical situations that we find in clinical scenarios. But please take a minute to read these studies, these articles, so you can find the best example to give during these interviews. Thank you.